Good day everyone, and especially to you, Sir Mr. Christian Perohan. My name is Kyla Perohan, and together with my group mates, Mr. Yangao, Miss Villegas, and Miss Quintano, we will be discussing about the exploratory laparotomy mechanical bowel obstruction. So, our topic outline is the definition, etiology and cause, clinical manifestation or the signs and symptoms, lab test and its significance to the condition, treatment or management, pharmacologic treatment, and of course the complication that might occur. So the objectives of this discussion is that at the end of this, we are to identify the exploratory laparotomy mechanical bowel obstruction and of course to know the goal of care given as an AMDNA student or a nursing assistant. First off is the identification. So you might be wondering, what is a mechanical bowel obstruction? A mechanical bowel obstruction is a partial or total obstruction of the gut. Although an obstruction can occur anywhere in the intestine, the small intestine is where it frequently happens. Why? Because the small intestine is located in the higher part of the intestine, while the large intestine is located in the lower part. So, mechanical causes of intestinal obstruction may include adhesion or scar tissue that forms after the surgery. And food and liquid cannot move through the clogged intestine. So, over the time that a person eats or the person digests, the food, liquid, and gas build up that result into a pressure and discomfort. Some blockages may stop the blood flow of the intestine if they are not treated, and this can result into a severe disease and can be the death of the intestinal tissue. Exploratory laparotomy. So, an exploratory laparotomy is a procedure to cut open the abdomen. So, when the abdominal injury necessitates, an immediate attention is also employed, and one substantial cut is made throughout the procedure, and we call it as a incision. So this operation is carried out to determine the underlying causes of issue that testing was not able to identify, such as the abdominal pain or the bleeding. So an exploratory surgery, it is done when looking for foreign object or foreign body that may be lodged in the body, when looking for a cancer or when looking for various other gastrointestinal problems. So it is fairly routine procedure only after the test and blood work reveals nothing abnormal. So later on, my group mates, Miss Quintano, will be discussing the possible lab test that would be done to the patient to know the underlying causes of this problem. So, the patient in this subgroup have higher mortality and morbidity due to frailty and poor nutrition status, and of course the immune response. So next is the etiology and cause. So the most small bowel blockage are due to the scar tissue, and this tissue connects the bowel into the abdominal wall or the other organs. So this makes the bowel to not work as needed if there is a blockage. So common etiology or cause of the obstruction or mechanical bowel obstruction are hernia, bowel inflammation or swelling, foreign matters in the intestine, impacted feces, volvulus, and intussusception. When we say hernia, it is the part of the intestine that pokes through the abdominal wall and squeezes the intestine to shut. So, when a hernia is not treated, it can develop into a small bowel obstruction, and most common types of hernia that cause small bowel obstruction can include inguinal, femoral, and incisional. So, if the patient is not able to push hernia in, the content of the hernia may be trapped, or this we call as an incarcerated in the abdominal wall. So an incarcerated hernia can become strangulated, which cuts off the blood flow of the tissue that is being trapped, and the strangulated hernia can be a life-threatening if it is not treated well. Next up is the bowel inflammation or the swelling. Inflammatory bowel diseases or the IBD is a group of disorder that causes chronic inflammation or the pain and the swelling in the intestine. So this IBD is term for two conditions, which is the Crohn disease and the ulcerative colitis, and these conditions are characterized by chronic inflammation of the gastrointestinal or the GI tract. So both of these disorder affects the digestive system. So if it is not treated immediately, an inflammation results in a damage of the GI tract. Next up is the foreign matter. So foreign matter are ingested objects that can get stuck in a digestive tract and sometimes perforate or pierce it. So foreign bodies may or may have not been accidentally or intentionally swallowed, and these foreign bodies may cause no symptoms or may cause symptoms depending of where they become stuck. So most of the time, the person who suffered from these problems are the infant. So infant does not know anything that they put into their mouth, so usually they swallowed it and it gets stuck to their intestine. And also, people who suffered in this problem are those people that are mentally challenged because they don't know what they are doing, so they are unaware of things that they put into their mouth and things that they are swallowing. Next is the impacted feces. Fecal impaction is the result of severe consumption, one constipation, when you are unable to regularly pass poop or stool or feces, and it backs up inside your large intestine or the colon. So fecal impaction can also be defined by your inability to sense or respond to the presence of stool into your rectum. So if you are unable to get this out of your body, it will, as I said earlier, it will back up inside your large intestine or your colon. So next up is the volvulus. A volvulus occurs when part of the colon or the intestine get twisted. Twisting causes bowel obstruction that may cut off the blood supply of the areas of the bowel. So, a volvulus, it is a medical emergency that needs surgical treatment. And volvulus of the colon and lower bowel typically occurs in adult and may be a result to a constipation, redundant intestinal tissue, an adhesion, or particularly after the surgery has been performed, or abnormal intestinal content. So the area of intestine above the obstruction can work well and function well to fill with food, fluid, and gas, while the other hand, the part or the lower part of the intestine that is being twisted, it will not work well, and it will be the blood supply will stop. And lastly is the intussusception. Intussusception is a serious condition in which part of the intestine slides into the adjacent part of the intestine. So this telescopic action often blocks food and fluid from passing through the intestine. So intussusception also cuts off the blood supply to the part of the intestine that is being affected, same as the volvulus. So intussusception is most babies up to 5 to 9 months old, but also to other children. And also boys got into susception more than girls.
Clinical manifestation, sign and symptoms. So first is abdominal pain. So abdominal pain, the pain that you feel anywhere between your chest and groin. This is often referred to as the stomach region of belly. So, and also abdominal pain is felt anywhere is the area between the bottom of the ribs and the pelvis. Pain is the abdomen may be itching, stabbing, burning, twisting, and cramping or dull. There are many causes of abdominal pain. So next is abdominal swelling. So abdominal swelling is more often caused by overeating than by a serious illness. So this problem can also be caused by swallowing air, fluid retentions in the stomach or abdomen. This can be a sign of serious medical problem. So next is abdominal cramps. So abdominal cramp is a colicky pain in the abdomen regions come and goes. One moment you may feel fine, but the next you may experience sharp, sudden pain in your abdomen. So, and also colicky pain. This is not this type of pains comes in waves. It very often starts and ends suddenly and is often severe. And the common causes of this type of belly pain is the kidney stone and the gallstone. So next is the nausea. The nausea is a feeling of discomfort that makes a person feel as though they might vomit. So, constant nausea is when these feelings last for the long period. So, there are conditions that can cause nausea, including stress, anxiety, infection, motion sickness, a sickness, and many more. So next is vomiting. So vomiting is an obstruction can cause the material inside the bowel to back up into the stomach. So this causes nausea and vomiting of dark green bile. So and vomiting is the vomiting is also the body ways of reading itself of harmful substance from the stomach, or it may be a reaction of something irritating the gut. So next is diarrhea. So diarrhea is more than 3 loose liquid stools in one day. It causes the body to lose fluids and electrolytes. So, diarrhea is also a common problem. So, it may last 1 or 2 days and goes away on its own. So, if diarrhea lasts more than 2 days, it may mean that you have a more serious problem. So next is severe constipation. So severe constipations is being constipated means your bowel movements are to or happen less often than the normal. So next is bloating. It happens when the organs or your digestive systems are stretched. For example, when liquid, gas, or solid pull in a part of your body, of your gut, I mean. So next is fever. So fever is intestinal obstructions may also cause serious infections and inflammations of your abdominal cavity known as peritonite, peritonitis, known as a peritonitis. So this occurs when portions of your intestine has ruptured. It leads to fever and increasing abdominal pain. Next is a full breath odor. So, a full breath odor, a blockage in your intestinal tract can cause breath that smell like feces due not only to the feces that are trapped inside your intestine but also due to food you've eaten that can't move down your intestinal tract. So the one significant health issue that can cause the breath to smell like a poop is an intestinal obstruction. This occurs when your small or large intestine is blocked, trapping feces and per, fermenting food in your body. So next is lab test, the significance to the condition. So the rationale for the lab test. So the goal of the diagnostic procedure to provide us useful informations to the clinicians regarding the person's abdominal problem, and also the findings serve as the basis for treatments planning and essential data during abdominal maintenance and the monitoring phases of treatment. And you will be also asked about the symptoms and medical history. A physical exam will be done, and and a stethoscope will be placed on your abdomen to listen for the bowel sounds. Absence or abnormal sounds may be suggest a bowel obstruction. So the first is X-ray. So X-ray, so abdominal X-rays may be used to diagnose causes of abdominal pain. So this can be include things such as masses, holes in the intestine or blockage. So this is the normal of X-ray. Normal bowel gas pattern, no evidence of dilatations. The vertebral column and the pelvis appear normal. No cause for pain was identified. And this is the abnormal. Circles of this X-ray of constipations in a young child show areas of a fecal material in the large bowel of rectum. So this is the two constipations in the two circles. So next is a Barrenium enema. So a barrenium enema is an X-ray of the lower intestine. Barrenium is a milky fluid that absorbs X-ray. So it is placed in the bowel of through the rectum. This is called an enema. This makes the area easier to see the and the X-ray. And and also barrenium enema is a X-ray exam that can detect change or abnormalities in the large intestine or colon. So the procedure is also called the colon X-ray. An enema is the injections of a liquid into your rectum through a small tube. That is the barrenium. And this is the normal. A barrenium enema exam is a considered negative if the radiologist detects no abnormalities in the colon. So, this is the abnormal. So barrenium colon enema shows an abnormal rectosigmoid ratio with delineations of the proximal sigmoid. So, sigmoid colon. A small caliber rectum and the transition zone of the rectosigmoid junction. So next is ultrasound. So ultrasounds uses sound waves to create pictures of the inside of the body. This type of ultrasounds takes pictures of the inside of the belly. This is normal. Normal pancreas, normal aortic caliber. Then the gallbladder is a thin-walled and non-tender with no stones or pericholistic fluid, no biliary delineations. The liver has a normal echogenicity and textures with a smooth surface contour. So the abnormal with an intestine wall thickness greater than 4 m, loss of layered appearance, lack of compressibility in plain presenteric fat becomes hyperechoic and produce a mass effect. So, next is a CT scan of the abdomen. So, a CT scan provides more detailed information about abdominal organs or structures that the standard X-ray of the abdomen, thus providing more information related to injuries and or diseases of the abdominal organs. So the normal is normal CT scan of the abdomen for the reference, oral and intravenous contrast was given. So scan performed so fine during the portal venous phase. Ay, so sa phase. So previous hysterectomy, the duplex collect collecting system on the right side in the anatomical variant. So the abnormal CT scan of the abdomen showed an inflammatory tumor in the lower right quadrant. So let's proceed to the lab test procedure. So so um so ab so abdominal X-ray. So the X-rays use a small dose of radiations to create pictures of the inside of the of the body. So this type of X-rays takes a pictures of the organs in the belly. So the left picture is our X-ray of the abdomen, and the right pictures is the illustration. So the rationale is the abdominal X-rays may use to diagnose to the causes of abdominal pain. So this can include things such as masses, holes in the intestine, or blockage. So and also abdominal X-ray is may be done before other tests that look at the GI tract or urinary tract. So the reason for the test. So this test may be done when there is a problem in the area from the chest to the pelvis, such as nausea and vomiting, belly pain or side pain, bloating, blood in the urine, and constipations or diarrhea, bloody or dark black stool, or trauma. So next is how the test is performed. So the test is done in a hospital radiology department, or it may be done in the healthcare provider's office by an X-ray technology. So you lie on your back on the X-ray table. The X-ray machine is the positions over your abdominal area. So you hold your breath as the pictures to taking, so that the picture will not be blurry. You may be asked to change positions to the sides or to stand up for additional pictures. So men will have a lead shield placed over this test to protect against radiation. With the test. So preparation for the test. So these are the preparation for the test. Before having the X-ray, ask the patients to the following. So you must ask the patient if the patient is pregnant or thinks she could be a pregnant. So, and does she have an IOD inserted, and thus she have had a barium contrast X-rays in the last 4 days. So if the patient has taken any medicines such as Pepto Bismol in the last 4 days, this type of medicine can interfere interfere with the X-ray. So and also assist the patients in wearing a hospital gown during the X-ray procedure. The patient must be remove all the jewelry. Why the test is performed? So the provider may order this test. So diagnose a pain in the abdomen or unexplained nausea. So identify suspected problems in the urinary system such as a kidney stone. So identify the blockage in the intestine, locate an object that has been swallowed, help diagnose diseases such as tumors or other conditions. So the normal result. So the X-ray will show normal structures for a person's your age. So abnormal findings includes abdominal masses, build-up of fluids in the abdomen, certain types of gallstone, foreign objects in the intestine, and hole in the stomach of the intestine, and also injury the abdominal tissue, intestinal blockage, and the kidney stone. So next is a barium enema. So a barium enema is an X-ray of the lower intestine. A barium is a milky fluid that absorbs X-ray. It is placed in the bowels through the rectum. This is called an enema. So this makes the area easier to see an X-ray. So the rationale of the barium enemas can help diagnose changes to your large intestine, such as your colon and rectum. Your doctor might recommend a barium enema to find inflammation, polyps, or cancer in your colon or rectum. So and the most common reason you may need to barium enema is after rectal surgery. So the reason for the test. So this procedure is done to look for problems in the lower intestine such as abnormal growth like polyps and cancers, ulcers, diverticula, small pouches in the wall of the large intestine. So, and also thickening of the lining of the large intestine. So, this preparation for the test. So, the preparation for the test is to advise the patients to empty his or her bowels for the exam. So if they are not empty, the test may miss a problem in the large intestine. So giving instructions for the cleansing the bowel using enema or laxatives. So this is also called bowel preparation. Follow the instructions exactly. Preparation for the test. So, for 1 to 3 days before the test, so a patient needs to be on a clear liquid diet. So, for example, of the clear liquid diets are clear coffee or tea, fat-free boilyum or broth, or gelatin, sport, sports drinks, or strained fruit juice, and water. So, why the test is performed? So, barium enema is used to perform. So detect or screen for colon cancer, diagnose or monitor ulcerative colitis or Crohn's diseases. Diagnose the cause of blood in stool, diarrhea, or very hard stool constipations. So these are the normal results. The barium should fill the colon evenly, showing normal vowel shape and positions, and no blockage. So the abnormal test results may be signs of blockage of the large intestine, narrowing of the colon above the rectum, Crohn's diseases or ulcerative colitis, cancer in the colon or rectum, sliding of one part of the intestine into another, small growth that stick out of the lining of the colon, called polyps, and small bulging sacs of the pouches of the inner lining of the intestine, called adverticula, twisted lobe of the bowel.
Diagnostic ultrasound of the abdomen. An ultrasound uses sound waves to create pictures of the inside of the body, and this is also a type of ultrasound takes pictures of the inside of the belly. So, the abdominal ultrasound is a non-invasive procedure used to assess the organs and structures within the abdomen. This includes the liver, the spleen, the bile ducts, the abdominal aorta, and the pancreas. So it is also allows quick visualization of the abdominal organs and structures. Next is the rationale. The rationale of the abdominal ultrasound can help determine the cause of stomach pain or bloating. It can help check for kidney stone, liver diseases, tumors, and many other conditions. Your provider may recommend this test if you are at risk of an abdominal aortic aneurysm. So, next is the reason for the test. So this test may be done to diagnose an injury or diseases. So abdominal ultrasound or the diagnostic ultrasound can examine or what kind of injury or diseases is that. Then it can also help find out the causes of belly pain such as appendicitis. It can also identify gallbladder stones or kidney stones and look at masses of fluid build up in the belly. Next, it can also look for the cause of poor liver or kidney function and help find out why an internal organ is larger than normal. And lastly, it can examine the baby and uterus of someone who is pregnant. So, next is the how the test is performed. An ultrasound machine makes images so that organs inside the body can be examined. The machine sends out high frequency sound waves which reflect all of the body structures. Then a computer receives the waves and uses them to create a picture. Unlike a X-ray or CT scan, these tests do not use ionizing radiation. So, the diagnostics ultrasound is safe because it did not use ionizing radiation, unlike the X-ray and the CT scan. So, ionizing radiation, um, it can alter molecules within the cells of our body, and it can cause cancer because the intense exposures of ionizing may produce skin or tissue damage. Next is the preparation for the test. Assist the patient to the ultrasound or radiology department. Next is to advise to avoid food and drinks for 8 to 12 hours before an abdominal ultrasound. So this is called fasting. Fasting helps prevent gas buildup in the belly area, which could affect the result. So the um so the client must do fasting and avoid food and drinks for about 8 to 12 hours before the abdominal ultrasound procedure. It is to prevent gas buildup in the belly, and that it can affect the result. And but you can ask the provider if it's okay to drink water. And then so kalagmitan every morning jud siya pagabuhaton ang procedure because or so that the overnight sleep will help the previous meal to be fully digested. So kalagmitan every morning jud siya buhaton ang procedure. So next, yes, as I said, ask the provider if it's okay for the patient to drink water before the test. Then advise patients to not stop taking any medication unless provider tells them to do, unless the physician will tell do so. So next is the normal result. Results are considered normal if the organs and structures being examined look okay. So, may balaan mo ang iyahong result if normal when you don't see any bad or any unnecessary sa iyahong organs and structures. So, the result will be normal. Then, what abnormal result mean? So, the meaning of abnormal result will depend on the part of the body being examined and the problem found. So, may bala nimo if kung abnormal ang iyang organ or you discover you see any dysfunction sa iyang organs or any structures sa iyang body. So, you can tell that the result is abnormal. Then, talk to your healthcare provider about your questions and concerns. Next is the CT scan of the abdomen or it is computerized tomography. So, a CT scan or a computerized tomography is a type of X-ray. It uses a computer to make pictures of the inside of the body, and in this case, images of the body lying between the chest and hips. So as you can see in the pictures, there are an image, a CT scan of the hips and the chest of a person. So as I said a while ago, this procedure is a little bit harmful for it's because it uses an ionizing radiation. So next is the rationale. A CT scan of the abdomen may be performed to assess the abdomen and its organ for tumors and other lesions, injuries, intra-abdominal bleeding, infections, unexplained abdominal pain, obstructions, or other conditions, particularly when another type of examination such as X-ray or physical examination is not conclusive. So, reason for the test. A CT scan is done to look at the organs and tissues in the abdomen when the doctor will look for the sign of injury, it can be tumors or any infections and other diseases. Next is how the test performed. So, patient will be asked to lie on a narrow table that slides into the center of the CT scanner. Then, once the patient is inside the scanner, the machine's X-ray beam rotates around you. Modern spiral scanners that can perform the exam while stopping. So, so the procedure, or how are you going to perform a CT scanner? So the patient must lie in a tunnel-like machine while the inside of the machine rotates and takes a series of X-ray from different angles. Question: is the CT scan painful? No, CT scan are painless and last approximately 15 minutes. So, CT scan can be done even if you have a full stomach. But if the CT scan without contrast, yes, na siya two types or two classification. A CT scan without contrast and a CT scan with contrast. So, if the doctor uses or asks for the CT scan with contrast, do not eat anything 3 hours prior to CT scan. So when we say prior, it is before the procedure or before doing the procedure. So next, a computer creates separate images of the body area called slices. These images can be stored, viewed on a monitor, or copied to a disk. Three-dimensional models of the body area can be created by stacking the slices together. It is dimensional, so the patient must stay still during the exam because movement causes blurred images. She may be told to hold their breath for short periods of time. So complete scans most often take only for a few minutes. The newest scanners can image your entire body in less than 30 seconds. So, preparation for the test. So, certain exam requires special dye called contrast to be delivered into the patient body before the test start. So contrast helps certain areas show up better on the X-ray. A contrast material is called a special dye because it helps the body to highlight the areas being examined. So contrast might be given to you by mouth or it can be given by your hand. So ask the patient if he or she has ever had a reaction to a contrast. They may need to take medicine before the test in order to avoid another reaction. So, contrast can be given in several ways depending on the type of CT being performed. So, it may be delivered through a vein or the intravenous in the hand or in the forearm. So it can also given by mouth or orally. So patient might drink the contrast before your scan. When they drink the contrast depend on the type of exam being done. The contrast liquid may taste chalky, although some are flavored, then the contrast passes out of the body through your stools. So the contrast will flow using the IV or the intravenous. So rarely, the contrast may be given into the rectum using an enema. If the contrast is used, advise the patient to not eat or drink anything for about 4 to 6 hours before the test. So, mao na akong giingon kanina na if with contrast and CT scan, you will advise not to eat anything within 4 to 6 hours before the test. So, before receiving the IV, contrast, ask the patient if he or she takes the diabetes medicine, metformin, or the glucopage. Then people taking these medicines may need to stop temporarily. So ask the patient if he or she has any problem with her kidneys. The IV contrast can worsen kidney function. So do not forget to ask any question to your patient if he has any allergic reaction with the IV contrast, because to avoid any dysfunction or to avoid any unnecessary things, and to avoid kidney function. Next, find out if the CT machine has a weight limit. If the weigh more than 300 pounds or equivalent to 135 kilograms, too much weight can damage the scanner. So, naadyo limit weight ang scanner, because it might be damaged if the pounds or the kilograms of a person is more than 135 kilograms. So lastly is to assist the patient to remove the jewelry and wear a gown during the study. So a jewelry must remove because metal object can affect CT images, and then wear a gown during the study. So why the test is performed? A computerized tomography scan creates a detailed picture of the body, including the brain, chest, spine, and abdomen. The test may be used to diagnose an infection. It is to guide a doctor to the right area during the biopsy. Then identify masses and tumors, including the cancer. Then study blood vessels. Then the normal results. Results are considered normal if the organs and structures being examined are normal in appearance. So, yes, you will say the examine or the result is normal when the doctor didn't see anything unnecessary on your organs and structures. So, while the abnormal result is a result dependent on the part of the body being studied, and talk to the provider about your questions and concerns, because doctors know all. And being if you have any concerns, uh, you patient or a client itself, dili dapat maulo nga mangutana, for because it is for your own sake naman. And doctors know kung unsay right for you, or what medication, or maybe the doctor can answer your concerns or questions.
Next is the treatment or management. First is nursing goal of care, AMDNA responsibilities, and the exploratory laparotomy. First is to monitor the vital signs of the patient, to assist draining the bladder and prevent urinary retention, to provide wound care and dressing changes to the patient, and lastly to assist with the nutrition and diet of the patient. The possible procedures in the vital signs taking or the TPRBP, first is the temperature or the axillary temperature. Usually 1 degree Celsius lower than an oral temperature. Place the thermometer in your patient's armpit and leave it in a place for as long as indicated by the device manufacturer. Next is we must measure the patient's radial pulse. So we must use the pad of your first three fingers to gently palpate the radial pulse at the inner lateral wrist and count the pulse rate in 1 minute. Count the respiratory rate of the patient unobstructedly while you are taking the pulse rate so that the patient is not aware that you are taking the respiration rate. Count for 30 seconds or for a full minute. if irregular. For getting the blood pressure of your patient, the patient must be sitting or lying down with a bare arm at the heart level. Palpate the brachial artery just above the antecubital fossa medially. Wrap the BB cuff around the upper arm about 2.5 cm above the brachial artery. Palpate the radial or the brachial artery with and inflate the BB cuff until the pulse rate is no longer felt. Then inflate 20 to 30 mmHg more. Place the bell of the stethoscope over the brachial artery and deflate the cuff slowly and evenly, noting the points of at which you hear the first appearance of the sound and the disappearance of the sound, the systolic BP and the dystolic BP. Next is catheterization. So in the process of catheterization, it allows the drainage of the urine if the patient have an obstruction in the tube that carries urine out of the bladder. First is we must wash our hands to avoid contamination. Next is provide adequate lighting. Next is to screen the patient and provide privacy to give a patient comfort and security. Next is position the patient on his back. Use the supine position. Drape the patient at the and let the patient remove his underwear. Next is clean the penis using the betadine solution. Cleanse the area at the meatus in a circular motion. Move from the meatus toward the base of the penis. Retract foreskin if uncircumcised dry. Place the catheter set next to the patient's legs. Set up the equipment and put on sterile gloves with technique. So by placing the catheter next to you, you have an easy access to the equipment such as clean gloves and etc. Cleanse the meatus, insert the catheter and hold the catheter with the non-dominant hand. For a dwelling catheter, inflate the retention balloon with a designated volume. Collect a urine specimen if needed. Allow a 20 to 30 ml to flow into the bottle without the catheter touching the bottle. Allow the straight catheter to continue draining and then attach the drainage of the end of the indwelling catheter to the collecting tubing or the bag. Examine and measure the urine and remove the straight catheter when urine is flowing. Wipe the perineal area of any remaining anesthetic or lubricant and return the client to a comfortable position. So after returning the patient to a comfortable position, we need to discard all the used supplies in appropriate receptacles and wash our hands to avoid contamination. Record the catheterization procedure including the size, result, complaints, color, time, consistency of the urine in the client's record, and return all the things to the CSR and to the nursing cubicles. Next is the wound care. So wound care involves various steps of wound management. So first thing you need to do in wound care management procedure or the wound care procedure is to pose only the wound site so you have an easy access or to the wound area. Next is place the equipment within reach of the work and wear mask, eye protection, and clean gloves. Pull the tape parallel to the skin and carefully gaze tracing at one at a time. Observe the character and the amount of drainage of the patient's wound and dressing, and then appearance of the wound. Dispose of soil dressing and change clean gloves to sterile gloves. So clean the wound with the solution from this contaminated area to the most contaminated area, using a separate swabs for each stroke. Apply anesthetic ointment if ordered, and apply a dry sterile dressing to the wound. You must cut a 4x4 gauze flat to fit around the wound and apply tape over the gauze over dressing. Next is the NGT feeding procedure. So NGT feeding is a special tube that carries the food and medicine to the stomach through the nose. First, in the NGT feeding procedure is usually visually inspect the condition of the patient's nasal and oral cavities. Assess for the best nostril before you begin. So you must pick the best nostril for the oral cavities before you begin the procedure. Palpate the patient's abdomen for the distension, pain, and or even the rigidity. Position the patient in sitting up at a 45 degrees with a pillow under the head and shoulders. Next is you place a towel on the patient's head and chest and provide a facial tissues and an emesis basin. Then measure the distance of the tube from the tip of the nose to the earlobe in the xiphoid process. You need to lubricate the NG tube tip so it is easily slipped to the nostril of your patient. Lubricate the NG tube tip according to your agency policy and apply non-sterile gloves to avoid contamination. Curve 10 to 15 cm of the end of the NG tube around your glove finger and then release it. You have the patient drop their head forward and breathe through their mouth. After that is insert the NG tubes tip slowly into the patient's nostrils and then advance it steadily in a downward direction along the bottom of the nasal passage with a curve and point downward in the direction of the ear on the same side as the nostril. You may feel a slight resistance as you advance along the nasal passage. You must twist the tube slightly, apply a downward pressure of the tube, and continue trying to advance the tube. If its significant resistance is felt, you must remove the patient's tube and allow the patient to rest first before trying again in the other side of the nostril. If there is difficulty in putting the NG tube or passing the NG tube, you may ask the patient to sip water slowly so the NG tube is easily inserted through its nozzle. Okay, so after the patient drink a sip of water slowly through a straw, unless a oral fluids are contradicted. If there is an oral fluids, you are the oral fluids are not allowed as the patient to try dry swallowing while you advance the tube. Continue to advance the NG tube until you reach the mark or tape the place for the measurement and temporarily anchor the tube to the patient's cheek with a piece of tape until you check the correct placement. You must verify the tube placement according to the agency's policy, and once the tube placement has been confirmed, mark it and record the length of the tube extending from the nose to the outer end of the tube. You can mark the tube by a permanent marker. Using the tube to the patient's gown with a safety pin allowing the tube length for comfortable head movement and then mark the tube at this point.
AMDNA responsibilities. So first, you need to check the doctor's order. It is to determine the type of delivery system given to the patient. So it means that a patient must do something because doctors or her or his doctor has told them to do it. So when you following or when a patient is following a doctor's order, it gives them a feedback on what is working or not. So a patient must do the doctor's order properly. It is to avoid any complication. So next is monitoring vital signs and providing oxygen as needed or if needed by the patient. So check for the temperature, pulse rate, respiratory rate, and blood pressure of the patient. So being a nursing assistant, you must always check the vital signs of your patient because it gives a baseline when a patient is healthy or not. So it is also very useful in detecting medical problems on your patient. So next is to perform catheterization. Empty the bladder before and after surgery and help perform certain tests. So it is very important to do the catheterization because it allows urine to drain. If a patient has an obstruction in the tube that carries the urine and useful po siya when a patient would undergo surgery. So next is the performing NGT feeding. So it is intended to hasten the return bowel function and prevent pulmonary complication, also diminish the risk of anatomic leakage and increase patient comfort and shorten hospital stay. So NGT tube or the nasogastric feeding is a tube where it pass through your nose and then down to the stomach. Then fluids that have become trough can be removed through this tube. So how is NGT tube is done? So the doctor or the nurse will insert the flat thin tube, in the nose of the patient and then down to the esophagus and then into the stomach. Then once this tube is in place, they can use it to give food and medicines. So next is assisting with wound care and dressing changes. It is to avoid infection to the patient and provide comfort and for a fast recovery of the wound area. So, it is to prevent, or one of the rationale of a wound care is to prevent infection and other complications, and it also helps speed up of the healing process and with less scarring. Next is positioning patients in bed pad, sore positioning boards, and to reduce movement if needed by the patients and to maintain the flow of blood in the body and to avoid bed soreness. So it is to prevent hyperextension and extreme lateral rotation and also to provide complications of immobility and injury. So it is essential aspect of nursing practice and responsibility of a nurse. Next is to maintain cleanliness and orderliness of the patient's unit at all times. Siyempre, cleanliness of the unit can also help the patient recover fast and also to make the patient comfortable. And one of the important of cleaning always the unit of the patient is to avoid the contamination and spread the germs. Lastly is to clean, sterilize stores, prepares and tissue dressings, pack, treatment trays and other supplies, measure INO. So after using the materials when doing a procedure, especially kung nag-wound care ang usa ka nursing aid, you must do sanitize the equipment because it is to reduce the microbial load on the surfaces prior to use. So, also, to always pack the sterile materials. So, mo na siya gitawag nga sterile pack. So, dito rin jud nakabutang ato ng sterile and ibulag siya into unsterile materials. And then, treatment trays and other supplies measured in I and O. So, before using the materials or the equipment um, being used in the procedure, always clean and sanitize the materials, and then put them back to the put them back or put the materials in place. Pharmacologic treatment. Antibiotic. Antibiotic is a broad spectrum antibiotic or ampicillin. It is given to prevent infection in open wounds. This may be necessary if there is osteomyelitis or if there is any question about whether an underlying infection was present at the time of surgery. So, antibiotic, it can protect against bacterial translocation and subsequent bacteremia in patients with intestinal obstruction. So, antibiotics such as ampicillin is used to treat certain infections that are caused by bacteria. Ampicillin is available under the following brand names. We have the Ampi, Omnipin, Penglobe, and Principin. So the availability of the medication is 250 milligrams or 500 milligrams for capsules, then 125 milligrams or 5 ml, 250 milligrams or 5 ml oral suspension, then 125 milligrams, 250 milligrams, 500 milligrams, 1 gm and 2 gm vials. The indication of the medication is infections of GEO, the respiratory and GI tracts and skin and soft tissues, also gonococcal infections, bacterial meningitis, otitis media, sinusitis and septicemia, and for prophylaxis of bacterial endocarditis is used parenterally only for moderately severe to severe infection. Now proceed to the nursing aid responsibilities. So first, you need to determine previous hypersensitivity reactions to penicillins, cephalosporins, and other allergens prior to therapy. So before going to the surgery, you must determine first the patient if he or she has sensitivity reactions on penicillins and other allergies prior to therapy. Next is to do the lab test. Baseline CNS test prior to initiation of therapy. Start drug pending result. Baseline and periodic assessment of renal, hepatic, and hematologic functions, particularly during prolonged or high dose therapy. So, it is very important to do the lab test before the therapy because it helps find possible problems that might complicate the surgery if not found and treated early. So note the sodium content of the drug must be considered in patients with sodium restriction. So when we say sodium restriction is a salt intake of less than 5 grams only per day. For adults, then the sodium content of the drug must be considered in patients in order to avoid fluid retention. So inspect skin daily and instruct the patient to do the same. The appearance of rash should be carefully evaluated to differentiate a non-allergenic ampicillin rash from a hypersensitivity reaction. Report rash promptly to a physician. So if you find out that the patient has a skin rashes due to the antibiotic taken, report it to the physician immediately and then differentiate a non-allergenic ampicillin rash from hypersensitivity reaction. So, another, it is just the same. The incidence of ampicillin rash is higher in patients with infectious mononucleosis or other viral infections, salmonella infections, lymphocytic leukemia, hyperuricemia, or in patients taking allopurinol. So, take medication around the clock. Continue taking the medication until it is all gone unless otherwise directed by a physician or a pharmacist. So, ATC or around the clock medication is a medication that is given regularly scheduled uh, interval scheduled intervals. Then throughout the day, one of the most responsibility of a nursing aide is to make sure that the patient take the medicine on time. It is to make sure that the body has an effective amount of drugs at all time. So now let's let's proceed to the side effect. So the side effect of antibiotics in the body is the patient must be can be experience wheezing, severe diarrhea or watery or bloody stools that may occur with or without fever, stomach cramps. It may occur up to 2 months or more than or after the treatment. Then a return of fever, cough, sore throat, chills, and other signs of infection. So now let's proceed to the anti-anxiety drugs, such as benzodiazepine or diazepam or buspirone is useful for anxiety, especially in the preoperative period, but are not recommended for use in the operating room or the OR. So anti-anxiety medication help reduce the symptoms of anxiety, such as panic attack and extreme fear and worry. So from the anti-anxiety words itself, it means for cure or medicines for person who are having anxiety or who are experiencing anxiety. So benzodiazepine or benzodiazepine are a group of medications that help reduce anxiety and make easier to sleep. So they are also used as a muscle relaxant to induce sedation. So the indication, diazepam is used to treat anxiety, alcohol withdrawal, and seizures. It is also used to relieve muscle spasm and to provide sedation before medical procedures. This medication works by calming the brain and nerves. Diazepam and belongs to the class of drugs known as benzodiazepine. Diazepine. So, benzodiazepine are also called minor tranquilizers. So, when we say minor tranquilizers, it have a calming effect and eliminate both physical and psychological effects of anxiety. So, they are the most widely prescribed psychoactive drugs in the world. So, anti-anxiety drugs or the diazepine are very helpful for the patient before going to the surgery. It is because it can calm the patient and help to relieve anxiety. So, let's now proceed to the nursing aid responsibilities. So, the nursing aid responsibilities, first, you need to monitor for adverse reaction. Then, or ADR, adverse reaction. So, adverse drug reaction. So, most are dose related. Then, physician will rely on accurate observation and report of patient response to the drug to determine the lowest effective maintenance dose. So, it is very important to monitor the adverse reaction on the medicine given because it is to prevent and identify and manage this effectively as well as to support patient adherence to their medicine. So ADR or the adverse drug reaction is the response of the drug, and also before letting the patient take diazepam, ask her or him if he or she has an allergy to the diazepam because there are inactive ingredients contained in the medicines which can cause allergic reaction. So next is to monitor for therapeutic effectiveness or the TDM. The maximum effect may require 1 to 2 week patient's tolerance to the therapeutic effects may develop after 4 weeks of treatment. The TDM or the therapeutic drug monitoring is the testing that measures the amount of certain medicines in your blood. So it is done to make sure the amount of medicine you are taking is both safe and effective. So observe necessary preventive precaution for suicidal tendencies that may be present in anxiety states accompanied by depression. Next is to observe the patient closely and monitor vital signs when the diazepam is given parenterally. Hypotension, muscular weakness, tachycardia, and respiratory depression may occur. Being a nursing assistant, your responsibilities is very important, especially when or monitoring the the vital signs of the patient. So always check the vital signs of the patient because they are there may be hypotension or muscle weaknesses or respiratory depression occur. So note that. Next is to the lab test, periodic CBC and liver function test during prolonged therapy, and then last is to do supervised ambulation. Supervised ambulation. Adverse reactions such as drowsiness and ataxia are more likely to occur in older adults, debilitated or those receiving larger doses. Dosage adjustment may be necessary. So dosage adjustment is necessary when an adverse reaction such as drowsiness and ataxia is occur. So let's proceed to the another. Monitor I and O ratio, including urinary and bowel elimination. Next is to note the smoking increases the metabolism of diazepam, lowering clinical effectiveness. So heavy smokers may need a higher doses than those who are non-smoker. Lastly is to note the psychic and physical dependence may occur in patients on a long-term high-dosage therapy, in those with histories of alcohol or drug addictions, or in those who self-medicate. So the possible side effects of the antibiotics are the drowsiness, dizziness, tiredness, blurred vision, or the unsteadiness may occur. Next, opioids. Opioids is used to manage pain during the surgery and postoperatively, particularly when an opioid analgesic is administered intravenously or IV in addition to an oral agent, codeine. So codeine is an opioid pain reliever. So opioid used to manage pain during surgery, or they are like a pain reliever including anesthesia. So an opioid analgesic is administered through IV or intravenously in addition to an oral agent or the codeine. So opioid is like a anesthesia. It's a kind of pain reliever. So the brand name for the opioids is OxyContin, Roxicodone, Oxecta, Oxido, Stamza AR, Percodan, Targenic, Zartims, or ZR. So the availability of the said medication is 15 milligrams, 30 milligrams, 60 milligram tablets, 15 milligrams, or 5 ml for oral solution, then 30 milligrams, 60 milligrams for injection. The indication, symptomatic relief of a mild to moderately severe pain when controlled and cannot be obtained by a non-narcotic analgesic, and to suppress hyperactive or non-productive cough. So the nursing aid responsibilities, an assessment for drug and drugs effects. So first, you need to record relief of pain and duration of analgesia. So being a aids, your main responsibilities, one of your responsibilities is to record every relief of pain of or the effectiveness of the codeine, or not only for the relief, or but every record that you must note. Being a nursing assistant, it is very important to note everything nga unsay mo makita or makita sa usa ka pasyente. You must be honest and note everything that you nga imong ma-discover sa iya sa imong patient. So next is to evaluate effectiveness as a cough suppressant. So cough suppressant is a codeine or cough suppressant is a codeine specific type of narcotic medicine called opioids. It is used to treat mild to moderate pain and also to reduce coughing. So treatment of cough is directed toward decreasing the frequency and intensity of cough without abolishing the cough reflex need to remove the bronchial secretions. So bronchial secretions are mainly produced by goblet cell, but they are small amounts of surfactant from cells or some other fluids that are part of the airway epithelium fluid. So, although codeine has a less abuse liability than morphine, dependence is a major unwanted effect. So, supervised ambulation and use other safety precautions as wanted, since drug may cause dizziness and lightheadedness. So, same as anxiety drugs, codeine also cause dizziness. So, we also need to supervise ambulation. Okay. Next is to monitor for nausea, a common side effect. Then report nausea accompanied by vomiting. Then change to another analgesic may be warranted. So next, let's tackle the side effects of the said medication. So the side effect can be the nausea, vomiting, constipation, lightheadedness, dizziness, or sweating may occur. So, muna siya mga possible side effect if you are taking opioids. So, the NSAIDs or the non-steroidal anti-inflammatory drugs, also called steroids. So the non-steroidal anti-inflammatory drugs are widely used to relieve pain, reduce inflammation, and bring down a high temperature. So NSAIDs are available by prescription and over-the-counter. The available drugs are about 200 milligrams. That is one pill for every 4 to 6 hours. Then 220 milligrams, that is one pill for about 8 to 12 hours, and 325 milligrams, 1 or 2 pills for every hours, and 3 to 4 pills every 8 to 12 hours. So the around the clock monitoring is really important when taking this medicine or the steroid. So a nursing assistant may teach their patient about the safe use of over-the-counter NSAIDs, including ways to track daily dose limits. So it is because NSAIDs are not suitable for everyone and can sometimes cause side effects. So that's why nursing assistant may teach their patients about the safe use and dosage of over-the-counter NSAIDs. So next is the metoclopramide. This is the antiemetic and prokinetic drug of choice for symptomatic partial bowel obstruction. This medicine is available only with your doctor's prescriptions. Note, only the doctor's prescription. This medicine is available only with the doctor's prescription. This product is also available in dosage forms such as tablet, disintegrating, or with about 10 milligrams for 4 times a day, taken 30 minutes before each meal and at the bedtime for 2 to 8 weeks. Then a nursing assistant may assist for gastrointestinal complaints such as nausea, vomiting, and constipation. Mo na yung mga possible effects, side effects, and also in oral administration for better absorption. Allow patients to wait for 30 minutes, 30 minutes to 1 hour before eating. So the laxative accuse. So suspension are given by mouth following the administration of 5 to 10 ml kilograms of water over 30 to 60 minutes. This may be repeated every 3 to 4 hours if necessary until bowel obstruction has been relieved or for up to 24 hours after initial treatment. This preparation should not be administered for more than 2 days in succession before obtaining an alternative method of bowel clearance. So next is the solid laxative. So these are administered orally in an amount equivalent to 1/3 to 1/2 of a normal diet, although relatively high doses up to 15 milligrams GM or by day may be required initially. So, wait. So, the laxative and solid laxative is the medication that people. So these two laxative is the medication that people use to stimulate bowel movement or to loosen up stool before going to procedure. Importante gapon ni siya nga medication because before the procedure, before going to the therapy, the patient must remove or to stimulate bowel movement or to loosen up stool before going to the procedure. So next, the last one is the intravenous fluid, the IV fluids. So formulated liquids that are injected into the vein to prevent or treat dehydration. The generic name for the IV fluid is bendroflumethiazide. Then that we can read it as bendroflumethiazide, naturitin. So for classifications, fluid and water balance agent, thiazide diuretic. So availability for this medication is 5 milligrams, 10 milligrams tablet. The IV fluids or using isotonic saline lactated Ringer solution is best for intestinal obstruction and it helps to stop dehydration. So the indication of the medication, bendroflumethiazide is a type of medicine called a diuretic. So it is used to treat high blood pressure, for hypertension and the buildup of fluid in your body or the edema. Then diuretic are sometimes called a water tablet. So when we say water tablet, it is causes is to remove excess water from the body by increasing how often you urinate. So yes, because they can make you more pee if you take this medicine, and then this help get rid of extra fluid in your body. So that is the diuretic or the IV fluid. Next is the nursing aid responsibilities, the assessment and drug effects. So monitoring BP. Report a sudden fall in BP which may initiate severe postural hypotension and potentially dangerous perfusion problem of the extremities, especially in older patients. Antihypertensive effects are generally noted in 3 to 4. Maximal effects may require 3 to 4 weeks. So always monitor the blood pressure of the patient if the patient has a sudden fall of blood pressure or the hypotension. The next is to monitor the INO ratio and pattern, and weigh, particularly during first phase of the anti-hypertensive therapy. Next is to do the lab test, the periodic serum electrolytes, then report hypokalemia promptly. So, report unexplained onset of the joint pain and limitation of motion, then may be due to hyperuricemia, since the thiazide interfere with uric acid exertion, although thiazides rarely precipitate acute gout. So, monitor diabetes for loss of glycemic control. So, these responsibilities are very important and must taken seriously, because being a nursing aide must the patient's life is all that matter. So always monitor and let the patient take the medication on time. Then the side effect of the IV fluids must be the bluish color. It can be weight gain, then blurred vision, fever, dizziness, swelling of the arms, feet, or the lower legs.
For the last part of our discussion is the complication. Complication vary depending on the reason of the surgery. So the most common risk and possible complication includes bleeding, infection, can't find the cause of the problem, so more surgery or other treatment may be needed. The incision does not heal well, damage, injury, or problem with the bowel, and of course the risk of reaction to the anesthesia. First off is the bleeding. So, bleeding is the loss of blood, and bleeding may be inside the body internally or maybe outside the body externally. So, bleeding may occur inside your body when blood leaks from blood vessels or the organs. It could also occur outside the body when blood flows through the natural openings such as the ear, nose, mouth, vagina, or the rectum. Next is the infection. So, the wound which has been stitched is seen 1 month after the hemicolectomy for bowel carcinoma, or the removal of the part of the colon to treat cancer. So, the infection can be treated with antibiotics drugs, as we have tackled earlier in the pharmacologic treatment by Miss Villegas. So, surgery that involves a cut or the incision in the skin can lead to a wound infection after surgery. So, as I've said earlier, most surgical wound infection showed up within the first 30 days after the surgery, or 1 month. So, the surgical wound infection may have pus draining from them and can be red, painful, or hot to the touch. So, as the common symptoms of infection is of course fever. So, can't find the cause of the problem, so more surgery and other treatment may be needed. So, it is very subutable, no? So, if the problem is not found, so more surgery, more lab tests, more procedure would be done. So, to know the underlying cause of this problem, or the things that has been happening in the abdomen of the patient. So, the incision does not heal well. So, a non-healing surgical wound can occur after the surgery when a wound caused by the incision does not heal as it is being expected. So, this is usually caused by infection, as what I have said earlier. So, a rare but serious complication. So, cause of poor wound healing depends on the type of location of the procedure, health condition, and other factors. So, it is very important for us as a nursing assistant to really do the wound care procedure seriously, because it really could lead into infection and other problems. So, next is the damage, injury, or problems with the bowel. So, bowel injury is a serious complication of gynecological laparoscopy. So, it's incident depends on the treated pathology and the type of procedure. So when the intestine is injured, the patient may develop stomach pain and tight distended belly. So if the material inside the intestine leaks out into the abdomen, it can cause into a serious and possible life-threatening infection. So some intestinal injuries do not cause symptoms right away, but may develop after many hours or even days. And lastly is the risk of reaction to the anesthesia. So general anesthesia causes you to become unconscious. So it is injected, the general anesthesia is injected to the person when the person is having a surgery. So the person would not feel pain or the process that is being done. So this type of anesthesia, while very safe, is the type that is most likely to cause side effects that carry risk. So most side effects that the person could feel are minors and temporary, such as nausea, vomiting, chills, maguro, confusion for days, so and a sore throat caused by the breathing tube. So that is all for the complication that might occur. So these are our references. And I guess that ends our recorded presentation, sir. Thank you so much for lending us your time. And if you have question, do not hesitate to type out your question to the comment box. Thank you so much, sir.